Hi there everybody and welcome back to my channel. Today I will be talking about retinal macroaneurysms. So if you want to learn more about what these are and how they can affect patients, then please stay tuned. The first thing to consider is what is an aneurysm. So basically you get a weakness within the wall of an artery, and when this weakness is present you can then start getting blood accumulated in a part of the wall where it would otherwise not be found. As a consequence of this, you start getting ballooning out of the wall of the vessel, and this gives this characteristic bulgy appearance to a blood vessel that has an aneurysm. Now, the issue with this aneurysm and the weakened wall is the fact that it can rupture, and in doing so, it leaks the contents from within the blood vessel. And when the blood, for example, gets onto the retinal surface, it can cause blurriness of vision, it can cause loss of vision, and also it can lead to fluid buildup at the macula being the part of your eye which gives you your sharp vision. So this is why it can be terribly problematic, and it can cause a catastrophic loss of vision very suddenly. In terms of who tends to get macroaneurysms, we know they are commonly found in the elderly, it's more common in females, and it is strongly associated with patients that have high blood pressure. Now, the other risk factors include cardiovascular risk factors, so patients with ischemic heart disease, patients with elevated cholesterol, diabetic patients, etc. So these are the important aspects to try and ascertain from a clinical history from the patient. In some patients, these macroaneurysms may be picked up incidentally. Now, the reason for this is if the blood vessel rupture occurs in a region of the eye other than the central part of your vision, then you may be unaware of it. That's why patients may attend for a routine eye test with their optometrist, for example, and this problem could be detected. On the flip side, if there is blood and fluid present at the macula, then patients may very well present with poor or reduced vision, and in association with this they may describe distortion, which is essentially where straight things look wavy. So if they were to look at the edge of a door and they knew that the edge of the door was straight, it would look wavy in its appearance. So this is a very telltale sign of something untoward occurring. Several fancy tests may be requested to try and definitively diagnose a macroaneurysm. However, with modern day imaging devices, usually a careful history, identification of risk factors, and some photographs of the back of one's eye can help to clinch the diagnosis. One of the telltale signs of a retinal artery macroaneurysm being present is when you have a trilaminar hemorrhage, meaning you have a retinal hemorrhage at multiple layers, so that being pre-retinal, intraretinal, and subretinal. Most commonly, the diagnosis of a macroaneurysm is made clinically as mentioned, and then patients are counseled as to what the diagnosis is and what the management moving forward will be. Usually these patients can be observed, and it is important to get on top of and identify, if not already known, underlying risk factors, so those being blood pressure, high cholesterol, diabetes, ischemic heart disease, etc. A referral to a family doctor or a GP is essential. However, in the first instance, you can try and understand whether any of these risk factors are present by performing a blood pressure measurement and checking the patient's sugar levels before you refer them onto the GP. With time and with addressing the underlying risk factors, most patients will find that they recover completely. In certain patients, if the bleed is located centrally and it is large, then there are surgical procedures that can be done to try and shift the fluid or blood away from the central part of the vision so that you reduce and minimize the risk of scar formation and therefore long-standing poor vision. Most patients with macroaneurysms therefore do well. It is also important to remember that patients that have macroaneurysms should be warned that they can occur again, and also they can be present in the other eye. So it's important to counsel patients well regarding what to potentially expect in the future. Thank you so much for watching this video on retinal artery macroaneurysms. I hope you've learned about what they are, what the risk factors are, how these patients present, and how these patients are typically managed. I thank the user that commented in the comment section on my page suggesting this video as a possible topic. If there are any other suggestions of future topics, I would be grateful to hear them. As ever, please do click the like button, subscribe, comment, and click the bell icon to stay up to date. Thank you so much. Take care.